Nursing assistant exam questions and answers. Question 1. What does the clinical abbreviation ABD stand for? Option A, abdomen. Option B, abduction. Option C, above bed device. Option D, absence of breathing. The correct answer is option A, abdomen. ABD is the standard medical abbreviation for the abdomen. Question 2. What does the abbreviation AC stand for in medical charting? Option A, after meals. Option B, before meals. Option C, at bedtime. Option D, as desired. The correct answer is option B, before meals. AC stands for anti-SIBUM, which means before meals. Question 3. What does the abbreviation ADL stand for? Option A, advanced daily living. Option B, activities of daily living. Option C, assisted daily living. Option D, average daily limits. The correct answer is option B, activities of daily living. Activities of daily living include basic self-care tasks like bathing, dressing, and eating. Question 4. What does the term ad lib mean when written in a residence care plan? Option A, as desired. Option B, at bedtime. Option C, after lunch. Option D, as tolerated. The correct answer is option A, as desired. Ad lib is short for ad libitum, meaning the resident can perform the activity as they wish. Question 5. What does the abbreviation AIDS stand for? Option A, acute immune deficiency syndrome. Option B, acquired immunodeficiency syndrome. Option C, acquired immune disease state. Option D, active immune deficiency symptoms. The correct answer is option B, acquired immunodeficiency syndrome. Acquired immunodeficiency syndrome is a condition caused by the human immunodeficiency virus. Question 6. What does the abbreviation AKA stand for in surgical terms? Option A, also known as. Option B, above the knee amputation. Option C, acute kidney ailment. Option D, active knee alignment. The correct answer is option B, above the knee amputation. An above the knee amputation is a surgical procedure to remove the leg above the knee joint. Question 7. What does the abbreviation AM stand for? Option A, after meals. Option B, in the morning. Option C, as measured. Option D, after midnight. The correct answer is option B, in the morning. AM refers to the morning hours before noon. Question 8. What does the medical abbreviation AMB stand for? Option A, ambulance. Option B, ambulate or walk. Option C, ambidextrous. Option D, ambient temperature. The correct answer is option B, ambulate or walk. Ambulation is the clinical term for walking. Question 9. What does the abbreviation AMT stand for in documentation? Option A, amount. Option B, amputate. Option C, ambulate. Option D, ammonia. The correct answer is option A, amount. Amount is used to document the quantity of intake, output, or other measurements. Question 10. What does the abbreviation AP stand for in relation to a pulse? Option A, average pulse. Option B, apical. Option C, after meals. Option D, as prescribed. The correct answer is option B, apical. An apical pulse is taken by listening to the heart directly with a stethoscope. Question 11. What does the abbreviation BID stand for in medical timing? Option A, once a day. Option B, twice a day. Option C, 3 times a day. Option D, 4 times a day. The correct answer is option B, twice a day. The abbreviation comes from the Latin bis in die, meaning twice a day. Question 12. What does the abbreviation BE stand for in radiology? Option A, before eating. Option B, barium enema. Option C, bowel elimination. Option D, basic exam. The correct answer is option B, barium enema. A barium enema is an X-ray exam that can detect changes or abnormalities in the large intestine. Question 13. What does the abbreviation BKA stand for? Option A, below the knee amputation. Option B, bowel and kidney assessment. Option C, body keen awareness. Option D, basic knee adjustment. The correct answer is option A, below the knee amputation. A below the knee amputation is a surgical removal of the leg below the knee joint. Question 14. What does the abbreviation BM stand for? Option A, body mass. Option B, bowel movement. Option C, blood monitor. Option D, breathing method. The correct answer is option B, bowel movement. A bowel movement is the excretion of solid waste from the digestive tract. Question 15. What does the abbreviation BP stand for? Option A, body position. Option B, blood pressure. Option C, breathing pattern. Option D, basic procedure. The correct answer is option B, blood pressure. Blood pressure is the force of blood pushing against the walls of the arteries. Question 16. What does the abbreviation BRP stand for? Option A, bed rest prescribed. Option B, bathroom privileges. Option C, basic room protocol. Option D, breathing rate pattern. The correct answer is option B, bathroom privileges. Bathroom privileges mean the resident is allowed to get out of bed to use the toilet. Question 17. What does the abbreviation C with a line over it stand for? Option A, with. Option B, without. Option C, clean. Option D, caution. The correct answer is option A, with. The symbol is derived from the Latin word cum, meaning with. Question 18. What does the abbreviation C stand for in temperature measurement? Option A, clean. Option B, centigrade or Celsius. Option C, caution. Option D, cold. The correct answer is option B, centigrade or Celsius. Celsius is a scale of temperature where water freezes at 0 degrees. Question 19. What does the abbreviation CA stand for in medical terms? Option A, cardiac arrest. Option B, cancer. Option C, calcium. Option D, clean area. The correct answer is option B, cancer. CA is a common clinical shorthand for cancer. Question 20. What does the abbreviation CABG stand for? Option A, cardiac area blood group. Option B, coronary artery bypass graft. Option C, common arterial blood group. Option D, coronary action blood gauge. The correct answer is option B, coronary artery bypass graft. A coronary artery bypass graft is a surgery that improves blood flow to the heart. Question 21. What does the abbreviation CAL stand for? Option A, calcium. Option B, calories. Option C, calculated. Option D, call light. The correct answer is option B, calories. Calories are a measure of the energy provided by food. Question 22. What does the abbreviation CATH stand for? Option A, catheter. Option B, cathedral. Option C, calculated. Option D, caution. The correct answer is option A, catheter. A catheter is a flexible tube used to drain fluid from or inject fluid into the body. Question 23. What does the abbreviation CBC stand for? Option A, complete bed care. Option B, complete blood count. Option C, common blood cells. Option D, cardiac blood count. The correct answer is option B, complete blood count. A complete blood count is a blood test used to evaluate overall health and detect disorders. Question 24. What does the abbreviation CBR stand for? Option A, complete blood report. Option B, complete bed rest. Option C, common body reflex. Option D, cardiac breath rate. The correct answer is option B, complete bed rest. Complete bed rest means the resident must stay in bed at all times. Question 25. What does the abbreviation CDC stand for? Option A, Centers for Disease Control and Prevention. Option B, Certified Disease Center. Option C, Common Disease Control. Option D, Community Dental Care. The correct answer is option A, Centers for Disease Control and Prevention. The Centers for Disease Control and Prevention is the national public health agency of the United States. Question 26. What does the abbreviation CNA stand for? Option A, certified nursing assistant. Option B, clinical nursing assistant. Option C, common nurse aide. Option D, certified nurse associate. The correct answer is option A, certified nursing assistant. A certified nursing assistant provides basic care and assists residents with daily activities. Question 27. What does the abbreviation CO stand for? Option A, clean only. Option B, complains of. Option C, condition of. Option D, care of. The correct answer is option B, complains of. This is used to document a resident's subjective reports of pain or discomfort. Question 28. What does the abbreviation CPR stand for? Option A, common patient recovery. Option B, cardiopulmonary resuscitation. Option C, cardiac pulse rate. Option D, clinical patient report. The correct answer is option B, cardiopulmonary resuscitation. Cardiopulmonary resuscitation is an emergency procedure that combines chest compressions and rescue breathing. Question 29. What does the abbreviation CNS stand for? Option A, common nursing staff. Option B, central nervous system. Option C, clinical nurse supervisor. Option D, cardiac nerve system. The correct answer is option B, central nervous system. The central nervous system consists of the brain and the spinal cord. Question 30. What does the abbreviation CS stand for? Option A, common sense. Option B, central service or central supply. Option C, clinical supervisor. Option D, cardiac surgery. The correct answer is option B, central service or central supply. Central supply is the department that provides medical and surgical supplies. Question 31. What does the abbreviation DOA stand for? Option A, date of admission. Option B, date on arrival. Option C, daily observation area. Option D, dietary order assigned. The correct answer is option B, dead on arrival. Dead on arrival means the person was deceased before reaching the facility or hospital. Question 32. What does the abbreviation DOE stand for? Option A, date of entry. Option B, dyspnea on exertion. Option C, daily oral exam. Option D, dietary output entry. The correct answer is option B, dyspnea on exertion. Dyspnea on exertion means difficulty breathing during physical activity. Question 33. What does the abbreviation DON stand for? Option A, daily observation note. Option B, director of nursing. Option C, Department of Nutrition. Option D, Director of Nutrition. The correct answer is option B, Director of Nursing. The Director of Nursing is the registered nurse in charge of the entire nursing department. Question 34. What does the abbreviation DRSG stand for? Option A, dressing. Option B, dosage. Option C, drainage. Option D, driving. The correct answer is option A, dressing. A dressing is a protective covering applied to a wound. Question 35. What does the abbreviation DX stand for? Option A, daily exercise. Option B, diagnosis. Option C, dose. Option D, drainage. The correct answer is option B, diagnosis. Diagnosis is the identification of a medical condition or disease. Question 36. What does the abbreviation ECG or EKG stand for? Option A, emergency cardiac group. Option B, electrocardiogram. Option C, electronic cardiac gauge. Option D, emergency kidney group. The correct answer is option B, electrocardiogram. An electrocardiogram is a test that records the electrical activity of the heart. Question 37. What does the abbreviation EEG stand for? Option A, emergency eye group. Option B, electroencephalogram. Option C, electronic ear gauge. Option D, emergency ear group. The correct answer is option B, electroencephalogram. An electroencephalogram is a test that records the electrical activity of the brain. Question 38. What does the abbreviation ENT stand for? Option A, emergency ear and nose team. Option B, eyes, ears, nose, and throat. Option C, external ear and nose treatment. Option D, emergency eye and nose treatment. The correct answer is option B, eyes, ears, nose, and throat. ENT refers to the specialized area of medicine covering those four parts of the head. Question 39. What does the abbreviation ER stand for? Option A, eating room. Option B, emergency room. Option C, exam room. Option D, exercise room. The correct answer is option B, emergency room. The emergency room is the department of a hospital that provides immediate treatment. Question 40. What does the abbreviation F stand for in temperature? Option A, fluid. Option B, Fahrenheit. Option C, fast. Option D, feet. The correct answer is option B, Fahrenheit. Fahrenheit is a temperature scale where water freezes at 32 degrees. Question 41. What does the abbreviation FBS stand for? Option A, fluid balance sheet. Option B, fasting blood sugar. Option C, fast blood study. Option D, final body survey. The correct answer is option B, fasting blood sugar. Fasting blood sugar is a test that measures the amount of sugar in the blood after an overnight fast. Question 42. What does the abbreviation FL stand for? Option A, flashlight. Option B, fluid. Option C, final. Option D, floor. The correct answer is option B, fluid. Fluid refers to any liquid substance. Question 43. What does the abbreviation FX stand for? Option A, function. Option B, fracture. Option C, friction. Option D, fix. The correct answer is option B, fracture. Fracture is the medical term for a broken bone. Question 44. What does the abbreviation FUO stand for? Option A, final urine output. Option B, fever of unknown origin. Option C, fast urinary output. Option D, frequent urinary output. The correct answer is option B, fever of unknown origin. This term is used when a resident has a fever but the cause is not yet identified. Question 45. What does the abbreviation GAL stand for? Option A, gallbladder. Option B, gallon. Option C, gauge. Option D, goal. The correct answer is option B, gallon. A gallon is a unit of liquid capacity equal to 4 quarts. Question 46. What does the abbreviation GB stand for? Option A, gastric bypass. Option B, gallbladder. Option C, goal balance. Option D, gauge board. The correct answer is option B, gallbladder. The gallbladder is a small organ that stores bile produced by the liver. Question 47. What does the abbreviation GI stand for? Option A, general intake. Option B, gastrointestinal. Option C, goal intake. Option D, gauge instrument. The correct answer is option B, gastrointestinal. The gastrointestinal system refers to the stomach and intestines. Question 48. What does the abbreviation GU stand for? Option A, general use. Option B, genitourinary. Option C, goal unit. Option D, gastric ulcer. The correct answer is option B, genitourinary. Genitourinary refers to the organs of the reproductive and urinary systems. Question 49. What does the abbreviation H or HR stand for? Option A, high. Option B, hour. Option C, head. Option D, health. The correct answer is option B, hour. Hour is a unit of time equal to 60 minutes. Question 50. What does the chemical abbreviation H2O stand for? Option A, hydrogen. Option B, water. Option C, heat. Option D, humidity. The correct answer is option B, water. H2O is the chemical symbol for water. Question 51. What does the abbreviation HIV stand for? Option A, health intake value. Option B, human immunodeficiency virus. Option C, high immune value. Option D, human infectious virus. The correct answer is option B, human immunodeficiency virus. Human immunodeficiency virus is the virus that causes AIDS. Question 52. What does the abbreviation HT stand for? Option A, heart. Option B, height. Option C, heat. Option D, high. The correct answer is option B, height. Height is the measurement of someone from head to foot. Question 53. What does the abbreviation HX stand for? Option A, height. Option B, history. Option C, heat. Option D, heart. The correct answer is option B, history. History refers to a resident's past medical events and conditions. Question 54. What does the abbreviation ICU stand for? Option A, individual care unit. Option B, intensive care unit. Option C, internal care unit. Option D, immediate care unit. The correct answer is option B, intensive care unit. The intensive care unit provides specialized care for critically ill patients. Question 55. What does the abbreviation INO stand for? Option A, in and out. Option B, intake and output. Option C, internal and oral. Option D, infection and observation. The correct answer is option B, intake and output. Intake and output is the measurement of fluids consumed and excreted by a resident. Question 56. What does the abbreviation IV stand for? Option A, individual visit. Option B, intravenous. Option C, internal valve. Option D, involuntary. The correct answer is option B, intravenous. Intravenous means within a vein, often referring to fluids or medications given that way. Question 57. What does the abbreviation L stand for on a medical chart? Option A, large. Option B, left. Option C, leader. Option D, low. The correct answer is option B, left. This is used to denote the left side of the body or a specific limb. Question 58. What does the abbreviation lab stand for? Option A, label. Option B, laboratory. Option C, lober. Option D, lower. The correct answer is option B, laboratory. A laboratory is a place where medical tests are performed on specimens. Question 59. What does the abbreviation LB stand for? Option A, lower body. Option B, pound. Option C, lober. Option D, lab. The correct answer is option B, pound. The pound is a unit of weight equal to 16 ounces. Question 60. What does the abbreviation LIQ stand for? Option A, light. Option B, liquid. Option C, limited. Option D, lower. The correct answer is option B, liquid. Liquid refers to a fluid substance. Question 61. What does the abbreviation LLQ stand for? Option A, lower left quadrant. Option B, left lower quadrant. Option C, lower level quantity. Option D, left lower quantity. The correct answer is option B, left lower quadrant. The left lower quadrant is a specific area of the abdomen. Question 62. What does the abbreviation HA stand for in medical shorthand? Option A, heart attack. Option B, headache. Option C, health assessment. Option D, high anxiety. The correct answer is option B, headache. Headache is pain in any region of the head. Question 63. What does the abbreviation NV stand for? Option A, next visit. Option B, nausea and vomiting. Option C, normal value. Option D, nerve value. The correct answer is option B, nausea and vomiting. Nausea and vomiting are common gastrointestinal symptoms. Question 64. What does the abbreviation PX stand for in some shorthand? Option A, pounds. Option B, stomach pain. Option C, pulse. Option D, position. The correct answer is option B, stomach pain. This shorthand is sometimes used to indicate abdominal or stomach pain. Question 65. How many cubic centimeters are in 1 ounce? Option A, 10 cubic centimeters. Option B, 30 cubic centimeters. Option C, 60 cubic centimeters. Option D, 100 cubic centimeters. The correct answer is option B, 30 cubic centimeters. 1 fluid ounce is equal to approximately 30 cubic centimeters or milliliters. Question 66. What does the abbreviation LOC stand for? Option A, left of center. Option B, level of consciousness. Option C, loss of contact. Option D, line of care. The correct answer is option B, level of consciousness. Level of consciousness is a measurement of a person's arousability and responsiveness. Question 67. What does the abbreviation LPN stand for? Option A, licensed patient nurse. Option B, licensed practical nurse. Option C, licensed professional nurse. Option D, local practical nurse. The correct answer is option B, licensed practical nurse. A licensed practical nurse provides basic medical care under the supervision of a registered nurse. Question 68. What does the abbreviation LT stand for? Option A, light. Option B, left. Option C, lower. Option D, long term. The correct answer is option B, left. This is a common shorthand for the left side. Question 69. What does the abbreviation LVN stand for? Option A, licensed vital nurse. Option B, licensed vocational nurse. Option C, licensed value nurse. Option D, local vocational nurse. The correct answer is option B, licensed vocational nurse. Licensed vocational nurse is the title used for an LPN in certain states like California and Texas. Question 70. What does the abbreviation LUQ stand for? Option A, lower upper quantity. Option B, left upper quadrant. Option C, level upper quadrant. Option D, light upper quadrant. The correct answer is option B, left upper quadrant. The left upper quadrant is a specific area of the abdomen. Question 71. What does the abbreviation MED stand for? Option A, medical. Option B, medications. Option C, medium. Option D, measure. The correct answer is option B, medications. Medications are drugs used to treat or prevent disease. Question 72. What does the abbreviation MID-NOC stand for? Option A, middle note. Option B, midnight. Option C, middle night. Option D, midnight observation. The correct answer is option B, midnight. Midnight refers to 12 o'clock at night. Question 73. What does the abbreviation MIN stand for? Option A, minimum. Option B, minute. Option C, minor. Option D, measure. The correct answer is option B, minute. A minute is a unit of time equal to 60 seconds. Question 74. What does the abbreviation ml stand for? Option A, meter length. Option B, milliliter. Option C, milligram. Option D, monitor level. The correct answer is option B, milliliter. A milliliter is a metric unit of liquid volume. Question 75. What does the abbreviation NA stand for? Option A, not applicable. Option B, nursing assistant. Option C, normal action. Option D, normal assessment. The correct answer is option B, nursing assistant. A nursing assistant provides basic care to residents under the supervision of a nurse. Question 76. What does the abbreviation NEG stand for? Option A, neglect. Option B, negative. Option C, negotiate. Option D, negative. The correct answer is option B, negative. Negative indicates that a test result did not show the presence of a specific condition. Question 77. What does the abbreviation NOC stand for? Option A, notice. Option B, night. Option C, normal. Option D, no change. The correct answer is option B, night. The abbreviation comes from the Latin noct, meaning at night. Question 78. What does the abbreviation NPO stand for? Option A, new patient only. Option B, nothing by mouth. Option C, normal pulse only. Option D, nighttime position order. The correct answer is option B, nothing by mouth. The abbreviation comes from the Latin nil per os, meaning nothing by mouth. Question 79. What is the chemical abbreviation for oxygen? Option A, H. Option B, O2. Option C, C. Option D, N. The correct answer is option B, O2. O2 is the chemical symbol for oxygen gas. Question 80. What does the abbreviation OB stand for? Option A, overbed. Option B, obstetrics. Option C, old body. Option D, observation. The correct answer is option B, obstetrics. Obstetrics is the branch of medicine dealing with pregnancy and childbirth. Question 81. What does the abbreviation OOB stand for? Option A, only on bed. Option B, out of bed. Option C, observation of body. Option D, only one body. The correct answer is option B, out of bed. Out of bed indicates the resident is allowed to be upright or in a chair. Question 82. What does the abbreviation OR stand for? Option A, oral. Option B, operating room. Option C, order. Option D, observation room. The correct answer is option B, operating room. The operating room is where surgical procedures are performed. Question 83. What does the abbreviation OS stand for in relation to anatomy? Option A, on side. Option B, mouth. Option C, open. Option D, outside. The correct answer is option B, mouth. OS is the Latin word for mouth. Question 84. What does the abbreviation OT stand for? Option A, oral treatment. Option B, occupational therapy. Option C, overtime. Option D, hold treatment. The correct answer is option B, occupational therapy. Occupational therapy helps residents regain independence in daily activities. Question 85. What does the abbreviation OZ stand for? Option A, ounce. Option B, ozone. Option C, order. Option D, original. The correct answer is option A, ounce. An ounce is a unit of weight or volume. Question 86. What does the abbreviation PC stand for in timing? Option A, pre-care. Option B, after meals. Option C, pulse count. Option D, prior to care. The correct answer is option B, after meals. The abbreviation comes from the Latin post cibum, meaning after meals. Question 87. What does the abbreviation PCA stand for? Option A, personal care assistant. Option B, patient-controlled analgesia. Option C, primary care associate. Option D, professional care aide. The correct answer is option B, patient-controlled analgesia. Patient-controlled analgesia is a method of pain control that allows the patient to self-administer medication. Question 88. What does the abbreviation PED stand for? Option A, pedestrians. Option B, pediatrics. Option C, pedicures. Option D, pedals. The correct answer is option B, pediatrics. Pediatrics is the branch of medicine dealing with infants and children. Question 89. What does the abbreviation PER stand for? Option A, prior. Option B, by or through. Option C, percent. Option D, period. The correct answer is option B, by or through. Per is used to indicate the method of administration, such as per OS for by mouth. Question 90. What does the abbreviation PM stand for? Option A, per month. Option B, afternoon. Option C, pre-medication. Option D, pulse monitor. The correct answer is option B, afternoon. PM refers to the hours from noon until midnight. Question 91. What does the abbreviation PO stand for? Option A, position. Option B, by mouth. Option C, postoperative. Option D, partial. The correct answer is option B, by mouth. The abbreviation comes from the Latin per os, meaning by mouth. Question 92. What does the abbreviation postop stand for? Option A, prior to. Option B, postoperative. Option C, position. Option D, postural. The correct answer is option B, postoperative. Postoperative refers to the period of time following a surgical procedure. Question 93. What does the abbreviation pre-op stand for? Option A, pressure. Option B, preoperative. Option C, prepare. Option D, prior. The correct answer is option B, preoperative. Preoperative refers to the period of time before a surgical procedure. Question 94. What does the abbreviation PrEP stand for? Option A, pressure. Option B, preparation. Option C, prior. Option D, preoperative. The correct answer is option B, preparation. Preparation refers to the steps taken to get a resident ready for a procedure. Question 95. What does the abbreviation PRN stand for? Option A, prior. Option B, when necessary. Option C, position. Option D, pressure. The correct answer is option B, when necessary. The abbreviation comes from the Latin pro re nata, meaning is needed. Question 96. What does the abbreviation PT stand for? Option A, point. Option B, patient. Option C, pulse time. Option D, partial. The correct answer is option B, patient. This is a common shorthand for a resident or person receiving care. Question 97. What does the abbreviation PT stand for? Option A, patient time. Option B, physical therapy. Option C, post-treatment. Option D, pulse test. The correct answer is option B, physical therapy. Physical therapy helps residents improve their physical strength and mobility. Question 98. What does the abbreviation Q stand for? Option A, quiet. Option B, every. Option C, quantity. Option D, quick. The correct answer is option B, every. The abbreviation comes from the Latin quisque, meaning every. Question 99. What does the abbreviation QH stand for? Option A, quick help. Option B, every hour. Option C, quiet hour. Option D, quantity high. The correct answer is option B, every hour. The abbreviation comes from the Latin quaeque ora, meaning every hour. Question 100. What does the abbreviation Q2H or Q3H stand for? Option A, quantity 2. Option B, every 2 hours or every 3 hours. Option C, quick twice. Option D, quiet twice. The correct answer is option B, every 2 hours or every 3 hours. This indicates how frequently a task should be repeated throughout the day. Question 101. What does the abbreviation QID stand for? Option A, once a day. Option B, 4 times a day. Option C, quick daily. Option D, quality. The correct answer is option B, 4 times a day. The abbreviation comes from the Latin quater in die, meaning 4 times a day. Question 102. What does the abbreviation R stand for in temperature? Option A, right. Option B, rectal temperature. Option C, rest. Option D, respiration. The correct answer is option B, rectal temperature. This indicates that a temperature was taken via the rectum. Question 103. What does the abbreviation R stand for in vital signs? Option A, right. Option B, respiration. Option C, rest. Option D, rectal. The correct answer is option B, respiration. Respiration refers to the act of breathing. Question 104. What does the abbreviation R stand for in direction? Option A, rectal. Option B, right. Option C, rest. Option D, respiration. The correct answer is option B, right. This indicates the right side of the resident's body. Question 105. What does the abbreviation RBC stand for? Option A, right blood count. Option B, red blood cell. Option C, rare blood cell. Option D, routine blood count. The correct answer is option B, red blood cell. Red blood cells carry oxygen from the lungs to the rest of the body. Question 106. What does the abbreviation RLQ stand for? Option A, right level quantity. Option B, right lower quadrant. Option C, routine lower quantity. Option D, right level quality. The correct answer is option B, right lower quadrant. The right lower quadrant is a specific area of the abdomen. Question 107. What does the abbreviation RO stand for? Option A, right side. Option B, rule out. Option C, rest only. Option D, routine observation. The correct answer is option B, rule out. Rule out is used to indicate that a specific diagnosis is being investigated and eliminated. Question 108. What does the abbreviation RN stand for? Option A, regional nurse. Option B, registered nurse. Option C, routine nurse. Option D, resident nurse. The correct answer is option B, registered nurse. A registered nurse is a licensed health professional who coordinates and manages resident care. Question 109. What does the abbreviation ROM stand for? Option A, read-only memory. Option B, range of motion. Option C, routine oral meds. Option D, right of movement. The correct answer is option B, range of motion. Range of motion exercises keep the resident's joints flexible. Question 110. What does the abbreviation RR stand for? Option A, right rate. Option B, recovery room. Option C, rest rate. Option D, resident report. The correct answer is option B, recovery room. The recovery room is where patients are monitored immediately after surgery. Question 111. What does the abbreviation RT stand for? Option A, rectal. Option B, right. Option C, rest. Option D, routine. The correct answer is option B, right. This is a common shorthand for the right side. Question 112. What does the abbreviation RUQ stand for? Option A, right upper quantity. Option B, right upper quadrant. Option C, routine upper quality. Option D, right under quantity. The correct answer is option B, right upper quadrant. The right upper quadrant is a specific area of the abdomen. Question 113. What does the abbreviation S with a line on top stand for? Option A, with. Option B, without. Option C, some. Option D, standard. The correct answer is option B, without. The abbreviation comes from the Latin sign, meaning without. Question 114. What does the abbreviation SNF stand for? Option A, safety nursing facility. Option B, skilled nursing facility. Option C, standard nursing facility. Option D, staff nursing facility. The correct answer is option B, skilled nursing facility. A skilled nursing facility provides 24-hour nursing and rehabilitation care. Question 115. What does the abbreviation SOB stand for? Option A, standard of breath. Option B, shortness of breath. Option C, sign of breathing. Option D, side of bed. The correct answer is option B, shortness of breath. Shortness of breath is the medical symptom of difficulty breathing. Question 116. What does the abbreviation SPEC stand for? Option A, special. Option B, specimen. Option C, speech. Option D, specific. The correct answer is option B, specimen. A specimen is a sample of tissue or body fluid used for medical testing. Question 117. What does the abbreviation SSE stand for? Option A, side-side exercise. Option B, Soapsuds enema. Option C, simple skin exam. Option D, surgical site exam. The correct answer is option B, Soapsuds enema. A soapsuds enema is used to relieve constipation or clear the bowel. Question 118. What does the abbreviation STAT stand for? Option A, stop. Option B, at once or immediately. Option C, stable. Option D, stage. The correct answer is option B, at once or immediately. The abbreviation comes from the Latin statum, meaning right now. Question 119. What does the abbreviation TBSP stand for? Option A, total. Option B, tablespoon. Option C, tablet. Option D, tube. The correct answer is option B, tablespoon. A tablespoon is a unit of volume equal to 3 teaspoons. Question 120. What does the abbreviation TID stand for? Option A, twice a day. Option B, 3 times a day. Option C, 10 times daily. Option D, today. The correct answer is option B, 3 times a day. The abbreviation comes from the Latin term die, meaning 3 times a day. Question 121. What does the abbreviation TLC stand for? Option A, total life care. Option B, tender loving care. Option C, today's lunch choice. Option D, true life change. The correct answer is option B, tender loving care. Tender loving care refers to the compassionate and attentive care provided to residents. Question 122. What does the abbreviation TPR stand for? Option A, total patient recovery. Option B, temperature, pulse, and respirations. Option C, time, pressure, rate. Option D, timed patient report. The correct answer is option B, temperature, pulse, and respirations. TPR are the 3 basic vital signs monitored in residence. Question 123. What does the abbreviation TSP stand for? Option A, total. Option B, teaspoon. Option C, tablet. Option D, tissue. The correct answer is option B, teaspoon. A teaspoon is a unit of volume equal to approximately 5 milliliters. Question 124. What does the abbreviation UA stand for? Option A, underarm. Option B, urinalysis. Option C, upper arm. Option D, unit assistant. The correct answer is option B, urinalysis. Urinalysis is the chemical and microscopic examination of urine. Question 125. What does the abbreviation UTI stand for? Option A, upper tissue injury. Option B, urinary tract infection. Option C, under threshold intake. Option D, unstable temperature increase. The correct answer is option B, urinary tract infection. A urinary tract infection is an infection in any part of the urinary system. Question 126. What does the abbreviation VS stand for? Option A, very small. Option B, vital signs. Option C, visual survey. Option D, valuable stuff. The correct answer is option B, vital signs. Vital signs include temperature, pulse, respirations, and blood pressure. Question 127. What does the abbreviation WBC stand for? Option A, whole body care. Option B, white blood cell. Option C, weak body condition. Option D, weight by choice. The correct answer is option B, white blood cell. White blood cells help the body fight off infections. Question 128. What does the abbreviation WC stand for? Option A, with care. Option B, wheelchair. Option C, warm compress. Option D, water closet. The correct answer is option B, wheelchair. A wheelchair is a chair with wheels used by people who cannot walk. Question 129. What does the abbreviation WT stand for? Option A, with. Option B, weight. Option C, weight. Option D, water. The correct answer is option B, weight. Weight is the measurement of how heavy a person or object is. Question 130. Which of the following would you observe in a resident with low blood sugar? Option A, sweet breath odor. Option B, shakiness or trembling. Option C, dry mouth. Option D, increased urine. The correct answer is option B, shakiness or trembling. Hypoglycemia often causes physical symptoms like tremors, sweating, and weakness. Question 131. When are residents most likely to feel the urge to have a bowel movement? Option A, before breakfast. Option B, after eating a meal. Option C, just before bed. Option D, during the night. The correct answer is option B, after eating a meal. The gastrocolic reflex is most active following the intake of food. Question 132. What should you do before helping a resident stand after they have been lying in bed? Option A. Give them a drink of water. Option B. Allow time for them to adjust by sitting on the edge of the bed. Option C. Ask them to count to 10. Option D. Turn on all the lights. The correct answer is option B. Allow time for them to adjust by sitting on the edge of the bed. Dangling at the bedside helps prevent dizziness caused by sudden blood pressure changes. Question 133. If a resident's breathing gets faster and they feel tired while dressing, what is the first action? Option A. Dress them faster to finish. Option B. Tell them to keep going. Option C. Stop the dressing to let them rest. Option D. Call for an ambulance. The correct answer is option C. Stop the dressing to let them rest. The priority is to reduce physical exertion and allow the resident to recover. Question 134. What is the most important part of planning priorities at the start of a shift? Option A. Deciding on break times. Option B. Checking if residents are divided evenly. Option C. Checking all assigned residents for immediate needs. Option D. Looking at the activity schedule. The correct answer is option C. Checking all assigned residents for immediate needs. Identifying residents with urgent needs ensures safety and timely care. Question 135. What is the best response if a resident refuses their scheduled walk at 10 a.m.? Option A. Tell them the doctor ordered it. Option B. Walk a little further later. Option C. Inform the nurse they are being difficult. Option D. Would you prefer to walk a little later? The correct answer is option D. Would you prefer to walk a little later? Offering a different time respects the resident's right to refuse while encouraging health goals. Question 136. Which of these is a common symptom of low blood sugar? Option A. High fever. Option B. Weakness. Option C. Sour breath. Option D. Frequent urination. The correct answer is option B. Weakness. Lack of glucose in the blood leads to a lack of energy and physical weakness. Question 137. What should you do if an alert resident wants to be alone with her visiting husband? Option A. Suggest the husband take her home. Option B. Tell them it is against policy. Option C. Allow the resident to be alone with her spouse. Option D. Stay in the room to monitor them. The correct answer is option A. Suggest the husband take her home. Residents have the right to privacy and to maintain marital relationships. Question 138. In a dark-skinned resident, what color might early skin breakdown appear? Option A. Pale red. Option B. Bright green. Option C. Purple. Option D. White. The correct answer is option C. Purple. In residents with high melanin, tissue damage often presents as dark or purple rather than red. Question 139. Which foods are typically high in protein? Option A. Pasta and rice. Option B. Meat and eggs. Option C. Fruits and vegetables. Option D. Whole grains. The correct answer is option B. Meat and eggs. Animal products and beans are primary sources of protein needed for tissue repair. Question 140. If you measure a resident at 5 feet 4 inches but they say they are 5 feet 6 inches, what do you do? Option A. Record it as 5 feet 6 inches. Option B. Tell them they are shrinking. Option C. Measure the resident again. Option D. Ignore the measurement. The correct answer is option D. Ignore the measurement. Rechecking a measurement ensures accuracy when there is a conflict in data. Question 141. What is the primary purpose of a physical restraint? Option A. To control behavior. Option B. To protect the resident from injury. Option C. To make the staff's job easier. Option D. To punish a resident. The correct answer is option B. To protect the resident from injury. Restraints are intended to prevent harm when a resident is at risk of falling or hurting themselves. Question 142. A resident with a hearing aid keeps asking you to repeat yourself. What is the first thing to check? Option A. Speak louder. Option B. Check if the battery was replaced recently. Option C. Ask the doctor to see them. Option D. Make sure the hearing aid is turned on. The correct answer is option D. Make sure the hearing aid is turned on. Always verify that the device is powered on and functioning before assuming other problems. Question 143. Where should the thermometer be kept for a resident in isolation? Option A, at the nurse's station. Option B, in the dirty utility room. Option C, in the residence room. Option D, on the isolation cart in the hall. The correct answer is option D, on the isolation cart in the hall. Dedicated equipment stays in the room to prevent cross-contamination to other residents. Question 144. What is the best reason for giving frequent perineal care? Option A, to decrease sexual responses. Option B, it increases the assistant's work. Option C, it helps prevent skin breakdown. Option D, it prevents incontinence. The correct answer is option C, it helps prevent skin breakdown. Keeping the area clean and dry prevents irritation and damage from urine and feces. Question 145. What is the first step you should take upon discovering a fire? Option A, check how fast it is spreading. Option B, remove any residents near the fire. Option C, throw a blanket on it. Option D, pull the fire alarm. The correct answer is option B, remove any residents near the fire. The rescue step in our ACE means moving people away from immediate danger first. Question 146. How can you prevent burns to residents during meals? Option A, add ice to all coffee. Option B, wait until the food is cold to serve it. Option C, let residents know which foods and beverages are hot. Option D, make them wear heavy gloves. The correct answer is option D, make them wear heavy gloves. Communication allows the resident to be careful and avoids accidental thermal injury. Question 147. What should you do if a resident says they are bored and the days seem to last forever? Option A, tell them your days are long too. Option B, ask about activities they have enjoyed in the past. Option C, tell them to read the schedule. Option D, ask the nurse for medicine. The correct answer is option C, tell them to read the schedule. Finding out a resident's interests helps the team provide personalized engagement. Question 148. Why must you check the feet of a diabetic resident every day? Option A, to check for vision problems. Option B, to look for sores the resident may not feel. Option C, to trim the nails so they aren't jagged. Option D, to check for foot fungus. The correct answer is option A, to check for vision problems. Nerve damage from diabetes can prevent a resident from feeling a serious injury or ulcer. Question 149. If a resident's hands shake and they spill liquids, what is the best response? Option A, thicken all their liquids. Option B, seat them alone so they don't feel bad. Option C, suggest a cup with a lid. Option D, force them to use a straw. The correct answer is option D, force them to use a straw. Adaptive devices like lidded cups promote independence while reducing spills. Question 150. If a dementia resident is more confused today and needs more help, what should you do? Option A, tell them not to feel bad. Option B, check if another assistant can do it. Option C, provide extra help as needed to avoid frustration. Option D, tell them they have to do it themselves. The correct answer is option B, check if another assistant can do it. Supporting a resident during fluctuating confusion prevents emotional distress and agitation. Question 151. If a bed rest resident cannot lift their hips for a bedpan, what should you do? Option A, turn the resident onto one side to place the pan. Option B, ask for a catheter. Option C, place a brief to collect the urine. Option D, have 3 people lift the resident. The correct answer is option B, ask for a catheter. Rolling the resident is the safest way to place a bedpan for those with limited mobility. Question 152. A resident cannot speak and is grabbing their throat. What is the first action? Option A, give them sips of water. Option B, ask them to take a deep breath. Option C, reach around from behind to provide abdominal thrusts. Option D, pat their back. The correct answer is option B, ask them to take a deep breath. The universal sign of choking requires immediate use of the Heimlich maneuver. Question 153. How can you best support a rehab resident who is recovering from a stroke? Option A, provide total care for them. Option B, set very high standards. Option C, help the resident focus on small accomplishments. Option D, remind them they will be happier at home. The correct answer is option C, help the resident focus on small accomplishments. Encouraging small gains helps the resident maintain a positive outlook during recovery. Question 154. A resident who is usually alert is suddenly confused today. What do you do first? Option A, increase their fluids. Option B, report the change to the charge nurse. Option C, ask them where they think they are. Option D, ignore it as part of aging. The correct answer is option D, ignore it as part of aging. Sudden changes in mental status can indicate a medical problem like an infection. Question 155. A resident finishes a seizure and is breathing on the floor. What is the next action? Option A, get the emergency cart. Option B, turn the resident onto her side. Option C, check if she can talk. Option D, help her back into the chair. The correct answer is option B, turn the resident onto her side. The recovery position helps keep the airway clear and prevents aspiration of saliva. Question 156. Which action is correct for handling a catheter drainage bag while the resident is in bed? Option A, hang it higher than the bladder. Option B, use the bag markings for measurement. Option C, raise the bed as high as it goes. Option D, wear gloves when emptying the bag. The correct answer is option D, wear gloves when emptying the bag. Standard precautions require gloves when handling any body fluid to prevent infection. Question 157. A resident wears a hand splint. What observation must be reported immediately? Option A, the splint was removed for cleaning. Option B, the fingers are cold and blue. Option C, the resident wants to take it off. Option D, the resident wants their arm moved. The correct answer is option A, the splint was removed for cleaning. Cyanosis or cold skin indicates the splint is too tight and is cutting off blood flow. Question 158. Which of these is true about the effects of aging? Option A, aging can be reversed. Option B, incontinence is a normal part of aging. Option C, joints tend to be less flexible as a person ages. Option D, sensitivity to pain increases with age. The correct answer is option C, joints tend to be less flexible as a person ages. The musculoskeletal system undergoes natural changes as a person grows older. Question 159. What should you report immediately for a resident in restraints? Option A, they say they don't like it. Option B, the position needs adjusting. Option C, they have suddenly become very agitated. Option D, the restraint was removed as scheduled. The correct answer is option C, they have suddenly become very agitated. Increased agitation in a restraint is a safety emergency and can lead to injury. Question 160. Persistent coughing after each drink is a sign of what? Option A, thirst. Option B, difficulty swallowing or aspiration. Option C, a common cold. Option D, being in a hurry. The correct answer is option B, difficulty swallowing or aspiration. Coughing during intake suggests fluids are entering the airway instead of the esophagus. Question 161. If a catheterized resident has only 50 milliliters of output in 6 hours, what is the first check? Option A, offer them more fluids. Option B, report it to the nurse. Option C, ask if they have pain. Option D, check to see if the tubing is kinked. The correct answer is option D, check to see if the tubing is kinked. Mechanical blockages are a common and easily fixed cause of low urinary output. Question 162. How should you interact with a resident who is comatose? Option A, avoid changing their position. Option B, keep the room dark and quiet. Option C, talk to the resident while providing care. Option D, perform mouth care only once a week. The correct answer is option C, talk to the resident while providing care. Hearing is often the last sense to remain, and residents deserve to be spoken to with respect. Question 163. If a resident cannot stand, how is height measured? Option A, adding up the length of body segments. Option B, asking the family. Option C, taking a measurement from head to heels while they are flat in bed. Option D, estimating based on their weight. The correct answer is option C, taking a measurement from head to heels while they are flat in bed. Measuring in bed ensures an accurate height for non-ambulatory residents. Question 164. A resident has a seizure at the dining table. What is the next action after the nurse is called? Option A, guide the resident from the chair to the floor. Option B, remove other residents from the room. Option C, try to open their mouth. Option D, hold them tightly in the chair. The correct answer is option A, guide the resident from the chair to the floor. Moving the resident to the floor prevents them from falling and allows for safe movement. Question 165. What is the best response if a resident says their food is poisoned? Option A, offer to taste it first. Option B, tell the nurse they are acting crazy. Option C, ask if there is something else they would like to eat. Option D, leave them alone until they are hungry. The correct answer is option C, ask if there is something else they would like to eat. Offering an alternative shows respect and ensures the resident still receives nutrition. Question 166. Which of these is an example of disinfection? Option A, washing hands after toileting. Option B, wiping around a stoma. Option C, cleaning a shower chair with a chemical cleanser. Option D, washing a bath basin with soap. The correct answer is option C, cleaning a shower chair with a chemical cleanser. Disinfection uses specific chemicals to kill pathogens on shared equipment. Question 167. Which of these is a protected right of a nursing home resident? Option A, selecting the staff for their care. Option B, having a private smoking area. Option C, making decisions about their care and treatment. Option D, having activities on the night shift. The correct answer is option C, making decisions about their care and treatment. Autonomy and participation in the care plan are fundamental resident rights. Question 168. If you report a red area on a resident's hip, what instruction should you expect? Option A, massage the area with lotion. Option B, position the resident to avoid pressure on that area. Option C, cover it with a heavy bandage. Option D, clean it with extra soap. The correct answer is option B, position the resident to avoid pressure on that area. Pressure relief is the primary treatment for early-stage pressure injuries. Question 169. When is it most important to check water temperature? Option A, during mouth care. Option B, soaking feet for foot care. Option C, giving a bed bath. Option D, washing your own hands. The correct answer is option B, soaking feet for foot care. The feet are very sensitive and can be easily burned if the soak water is too hot. Question 170. Pain in the arms and jaw, along with nausea and sweating, can indicate what? Option A, indigestion. Option B, a heart attack. Option C, the flu. Option D, a skin allergy. The correct answer is option B, a heart attack. These are classic signs of cardiac distress that require immediate emergency reporting. Question 171. What should you do if a resident is eating very little lunch? Option A, check if they were snacking earlier. Option B, ask if they would like something else to eat. Option C, tell them dinner is a long way off. Option D, check their last bowel movement. The correct answer is option B, ask if they would like something else to eat. Providing a preferred alternative helps maintain the resident's nutritional status. Question 172. What is a safe way to prevent confused residents from accidentally leaving the building? Option A, block the exit doors with furniture. Option B, restrain the residents in chairs. Option C, place large stop signs on the doors. Option D, lock them in their rooms. The correct answer is option C, place large stop signs on the doors. Stop signs or disguised doors are effective non-physical deterrents for elopement. Question 173. When a resident wears compression stockings, what should you observe closely? Option A, their shoe fit. Option B, the color of the resident's toes. Option C, their pulse rate. Option D, how fast they walk. The correct answer is option B, the color of the resident's toes. Blue or white toes indicate that the stockings are too tight and are blocking circulation. Question 174. During perineal care, why is it important to change the spot on the washcloth? Option A, to save on laundry. Option B, to keep the soap from drying out. Option C, to prevent the spread of bacteria. Option D, to make the procedure faster. The correct answer is option C, to prevent the spread of bacteria. Using a clean area of the cloth for each stroke ensures you are not moving germs back and forth. Question 175. If a resident misses breakfast because they dress slowly, what should you do? Option A, dress them yourself to make it faster. Option B, set out easier clothes. Option C, ask if there is any help they would like in the morning. Option D, tell them they can just skip breakfast. The correct answer is option C, ask if there is any help they would like in the morning. Providing the specific help the resident wants promotes independence and social participation. Question 176. A trash can is on fire in a resident's room. What is the first step? Option A, put it out with water. Option B, open the windows. Option C, remove the resident from the room. Option D, yell fire and state the room number. The correct answer is option C, remove the resident from the room. The rescue step is always first to move the vulnerable resident away from the danger. Question 177. A resident with a feeding tube pump needs a shower. What is the correct response? Option A, disconnect the tube yourself. Option B, protect the pump with a bag and take it in. Option C, ask the charge nurse for assistance with the pump. Option D, give a bed bath instead. The correct answer is option C, ask the charge nurse for assistance with the pump. Nursing assistants are not authorized to handle or disconnect medical pumps. Question 178. What is the normal appearance of human urine? Option A, cloudy. Option B, dark yellow. Option C, clear. Option D, strong smelling. The correct answer is option C, clear. Healthy urine is typically clear and straw-colored. Question 179. A resident with a history of falls is on the floor crying. What do you do first? Option A, call for help while keeping them calm. Option B, check for injuries while asking how they fell. Option C, put a pillow under their head. Option D, tell them they should have been more careful. The correct answer is option A, call for help while keeping them calm. Emergency protocols require a nurse's assessment before the resident is moved.